This is a case study and lesson plan video created by Kenyatta Cochran and Kermit Ali to fulfill the requirements of the SPED 5481 course with Dr. Lynch and Dr. Smith. The focus of our case study is a 9-year, 11-month boy named Lee who has cerebral palsy, spastic quadriplegia. Lee is enrolled in School X Special Needs Program and has been diagnosed with related motor difficulties significantly impacting speech production, feeding, and causing receptive and expressive language delays. Our primary objective for this case study included an analysis of Lee's strengths and weaknesses, a description of the test and assessment results, a description of the informal and formal test results, a remedial plan, and lesson plans. Starting with the strengths, Lee is communicative and has the ability to use multiple forms of communication to get his point across. Lee can say the word no and can independently and effectively employ a combination of eye gaze, differentiated vowel sounds, arm movements to raise his hand, head nodding, shaking, emotional responses, and verbal production, again, of the word no. Along with his understanding of the vocabulary, his concept knowledge, understanding of WH questions, and comprehension, and his ability to incorporate messages that include negation has improved. He can also identify 10 primary colors, in addition to 6 geometric shapes, and is great with sight words. Lee is very attentive to what is going on around him. He enjoys church, cartoons, and this particular point is the gist of our lesson plan, in which Lee enjoys being read to. Moving on to Lee's weaknesses, Lee is totally dependent on caregivers for all activities of daily living and positioning. Lee also has limited reaching ability, limiting his ability to grasp objects that are far in reach. Lee's disability has relegated him to the use of a wheelchair for mobility for the most part. He has sporadic meltdowns when he feels envious of same-age peers that have normal abilities. Lee has difficulty with understanding how others feel and the ability to attend to a task for extended periods of time. I think the most important part of this particular study of the strengths and weaknesses, or one of the most important parts that we played on as a team, was the fact that Lee enjoyed being read to, and we decided to design our lesson plans with an abundance of opportunities for Lee to get to receive this sort of attention. Lee had a series of both informal and formal tests administered to him, and we used this information to come up with the best remedial plan we could moving forward. Two particular tests that stood out to us were the Peabody exams, the Peabody Achievement Test and the Peabody Vocabulary Test. In our table, if you notice the green arrows trending up, and this is because the Peabody Achievement Test, among other things, tested reading comprehension and recognition, showing that Lee could identify sight words, and we thought that this was very positive and very encouraging moving forward towards the lesson plans. The Peabody Vocabulary Test found Lee to be performing just outside the average range of his chronological age level, and this was an awesome find because it showed that he wasn't performing 2 standard deviations beyond the norm, and this was very encouraging also moving forward to the remedial plans. So looking at the research, 2 authors in particular, Fiera's group and Chiarello's group, both agree that AAC and learning games are very important in encouraging effective communication among people with severe disabilities. With that information in mind, and the fact that his notable strengths were the fact that he enjoyed being read to, he understood sight words, and he could answer yes/no questions using his AAC device, we came up with the plan to incorporate or include Lee in regular ed reading classes for 50 minutes daily. In situations, putting Lee in situations where he can use his strengths to 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 function and communicate with his regular ed peers. Lastly, we want to look at Lee's chair, and Lee is now functioning with an manual chair with a cushion molded seat, and he often experiences pain and discomfort, and we feel like he could benefit from a power control chair instead of a manual chair, and a cushion such as an air cushion that would ensure controlled airflow and allow him to sit for long periods of time without discomfort. And we thought his chair should have head control and standing features that allow Lee to be at eye level with his peers. Lee could benefit from this kind of assistive technology to support his inclusion progress at school. Thus, moving forward to further addressing Lee's needs in class, of course, his lessons will always be differentiated in nature, and we'll always try to incorporate some games and some fun activities. We also have a in-class store that Lee will make himself even more a part of the fabric of class, because every student will have to go to Lee to recoup prizes, rewards, and things of that nature. So again, looking at his strengths, we want to make sure everybody got involved with Lee and read to Lee, starting off with the teacher doing our reading loud activities, and then the advanced readers will get a chance to read, and Lee will get a chance to hear everybody read in our choral reading activity. And we want to make sure, in conclusion, as the cartoon implies, we as teachers would all love for our students to be model students, be independent, be critical thinkers, and be obedient. However, this is never the case, and we have to learn to adapt our classes in order to foster an environment in which we can get the best out of every student in our class. So on behalf of Dr. Lynch, Dr. Smith, Kenyatta Cochran, and myself, I would like to say thank you for viewing. I hope you all have a great rest of your summer, and goodbye.